An early warning system, particularly when we look at the infectious disease context, it's actually a very sophisticated mathematical model that uses our health surveillance data in order to potentially predict when an outbreak might occur in the future.
This is particularly important because in small island developing countries where resources are usually limited in terms of finance and also personnel, I think it's important because it allows the ministries of health to have a better lead time.
In around 2018, there was a researcher in Barbados with a global climate group that was looking at the occurrence of dengue outbreaks in Barbados with a bit of mathematics. It was theorized that the occurrence of outbreaks interacted with the temperature and the rainfall. The mathematical function of the relationship between the two could be used to say when an outbreak was likely to happen.
This led us to developing a modelling approach to understand how both drought and exceptionally wet conditions can impact dengue in the region. And we've been building this modelling approach into a co-creation process where we can embed this modelling within the protection processes of the Ministry of Health and Wellness, together with meteorological services, to provide operational early warnings of dengue risk several months in advance.
One of the reasons we chose, for example, Barbados in particular, was because they've had a long history in terms of working with us on vector-borne diseases. We have a really great success story for Barbados. So their present data, we would have taken it and fed it into the early warning system model that we developed about 3 months in advance of the ICC T20 matches being held in the Caribbean. Because of that information, a couple of months in advance, the Ministry of Health was able to be proactive. Basically, no outbreak occurred because we were able to tackle it in time. And a key aspect is also engaging with the community and particularly working with them to try and identify breeding sites around their businesses, homes, and communities in order to reduce mosquito breeding and, of course, reduce disease transmission.
In the Caribbean region, there's a great opportunity to integrate all the climate forecasts and outlooks that are being provided at both the regional and the national level. And we've been working to integrate this information within health impact modelling approaches so that we can provide warnings in advance about elevated disease risk. And that can then prompt anticipatory action to improve preparedness and response to the possibility of outbreaks of diseases like dengue.